Hello guys, this is Brian here with an update video. Today is December the 12th, 2017. Found out I'm going to have surgery, unfortunately, and kind of dreading it. I found out that I'm going to have surgery on the wrist and at the elbow due to carpal tunnel and cubicle tunnel. I kind of found out about this back in 2015 by the neurologist doing a nerve test, and at the time I was telling him I mainly had numbness and sometimes pain, but it's getting worse and it has to be something done about it. And actually I have injured my hand a couple different times back in October, and keep re-injuring it, and it's getting worse. Cubicle tunnel, I really didn't know what that is until I kind of looked it up. The doctor kind of told me about it, and I looked it up to get more information. Is the pinched nerve right here, and then carpal tunnels right here. As well as I have a pinched nerve in my neck, so that's just compounding the problems more. So I had another nerve test done back in October, and the reason why that was because I went to my spine doctor, neurosurgeon, for a follow-up, and I kind of told him, I want you to go in there and fix my neck. I think it's time to do that. Blue Cross is changing next year, and God knows what's going to happen. Might as well have something done, before the end of the year, which is covered at 100%, versus what's going to cost all money down the road, And he said, well, let me order a new MRI, a nerve test, a flex x-ray, and see what's actually being pinched at, to make sure he can even to get to it. Some places, I guess, they can't get to it. He said if for some odd reason he can't get to it, there is a backup plan called, what I can have done is called a spinal cord simulator. And that's supposed to disrupt the nerve and pain signals that go up to your brain. It's an implant device. I'm not really too keen on the idea. I'm really on the fence about that. I don't want something implanted in me. No, thank you. Because there's really two procedures involved in that. Involves a trial period where they don't actually implant it, so it's outside your body with a little lead sticking out of your back. Who wants that? For 5 to 10 days. And then if it does work, obviously they take the leads out, and then they will go in there and implant it. So they see if it works for you beforehand. It's one of those things. It's not, depending on the particular, it's not 100% going to work for every single person, because it involves nerves in your spinal cord and all that. Some people may not get relief from the device, so we shall see. I'm not really want to go down that road anyway. So there's something that luckily my neck. It is being manageable by steroid injections and pain pills and muscle relaxers. It's nothing urgently like my back was, so that can be kind of pushed down the road later 2018, if I choose to do anything. If I do, I want to lean towards neck surgery versus an implant device. But anyways, I kind of got sidetracked here. So I went to have the nerve test done. It shows the pinched nerve in the elbow and the wrist, actually on both sides, the left and right. It's getting worse. I don't know exactly how that happened, really. How that could happen. I don't know if I've fallen, and I really don't remember. Only time I really remember falling is when it was iced out, when it sleeted outside and I fell in the driveway real hard. Of course, that could have done it. You never know. Of course, I went to Six Flags a couple different times, so that could compounded the problem, riding roller coasters, Texas Giant a couple different times. So that probably really, really compounded the problem. Made it worse. But I went to further have an MRI done and a steroid injection done. Now, I thought, well, I'm smart. I'm going to have it done all at one day at the hospital. And I got to thinking, well, I better not have it all done at one day because Blue Cross Blue Shield may not like that, may not pay for it. Because the pain management doctor is doing the steroid injection, and then you got the doctor's name on the MRI. Two different procedures really on the same day. Two different physicians. So I decided to call them back and tell them, I'll just do it the day before. Well, I was in the MRI machine for about almost an hour and a half. Very painful. My hand and arms, or arms and hands were against the tube because it was real small. So I was like this. Afterwards, my wrist was hurt really bad in the arms. So that's when I injured it then, apparently. And then the very next day when I had the steroid injection done, of course, they roll you over onto your stomach and they do the neck. And after you kind of come out of the sedation, I guess I used my right arm to pull myself up and roll myself over back onto my back. Hurt it then. It hurt like hell. By this point, it's already inflamed and swollen and all this. And the neurologist told me, you need to go see a hand specialist and eventually a hand surgeon, that is. And by the next week, my hand was, my wrist was swollen, my hand hurt my cal. So I went to my permanent care doctor, and they took an x-ray, and luckily it was nothing broken or anything like that, obviously, but they took an x-ray just to be on the safe side. And the doctors, and I told him, I think I need to go see a hand specialist. Here's my results of the EMG tests. And he said, sure, yeah, you need to see a hand surgeon. And he did tell me, most likely, you're either going to have a steroid injection done, or they might just go do surgery. There's really not too many options to really treat this. Pinch nerves. Yeah, you can do physical therapy, but ultimately, at the end of the day, still going to be pinched. Some people do find relief with physical therapy. But really, at the end of the day, it's still going to be pinched. It's not magically going to readjust itself. Just like if you had a herniated disc in your back, well, you can do physical therapy first, but really, at the end of the day, it's still going to be herniated. It's still going to be in the same spot, and that's what the hand specialist kind of said too. Anyway, so luckily there. But the hand specialist and also the neurologist said, if you don't treat it and you ignore it, and eventually you will have nerve damage, pain, and might as well just fix it now. So I'm going to have it done next week. Now, of course, I went to the hand surgeon Monday following Thanksgiving. Let me tell you about this. There was an incident. Well, not really an incident. I gave the doctor the name of the doctor I chose out in Dallas. Well, they called me back once the HMO approval was approved, but the lady at the doctor's office called and said, I don't know if they told you or you may not know. Well, when I called them to before I send them the paperwork, they booking appointments out to March. And the lady said, I think, if I was in your shoes, you'd probably choose another doctor. So that's ridiculous to wait that long. Late February to early March. Now, of course, this was like a week or two before Thanksgiving by this point. So pushing 3 to 4 months, right? Ridiculous. I never heard of that, never experienced that. Maybe if you were seeing the very top doctor in the United States, maybe. or if you were seeing Dr. Oz to have heart surgery, maybe, something like that, obviously, but nothing run-of-the-mill specialist. No, never experienced that or heard of such a thing. So she said, you need to try to choose another doctor if you don't want to wait. Obviously, of course, my hand was hurting. No, I didn't want to wait. So I went to Blue Cross's website and got the second name and third name, and I called the other doctor, the second one on the list, out in Plano. He was located in Plano, and I called him, and luckily I had the common sense to do that. Well, how long are you, how far out are you booking? Because my doctor called the insurance company. They did approve the HMO referral, so it's ready to go. I just need, choose a doctor. She said, oh, no, we can see you the Monday after Thanksgiving. No problem. Sure enough. And I could have sworn I have seen something in my policy book or on the Texas Department of Insurance that if you have an HMO, that the provider has to see you within a certain time frame, because then it falls under the category as access to care or delay medical care underneath the HMO. I have to look into that more, or the insurance company can't take that long to approve HMO referral, somewhere like that language. I have to look into that. So I went to the hand specialist, and he did all these little tests, see kind of if I could feel my fingers, and they were numb, obviously. He said, well, you really need 2 procedures done. You got to pinch nerve in the elbow, and then at the wrist, carpal tunnel and cubital tunnel. If we don't do nothing about it, it will get worse over time, obviously. It's getting worse now. And he said, of course, I have it in the left and right hands, but right is bothering me. Obviously, we're not going to mess with the left because it's not bothering me. So having it done next week. It is potentially outpatient, so no big deal there. Very rarely miss people to stay overnight for this. So it is going to be cut right here and not here. Not looking forward to that, obviously. Kind of scared, because it is involving nerves. I don't know, I'm just worried about it. Because, I could put it off, but then it's going to hurt, and it's just going to compound itself, make it worse. Yeah, I could take pain pills and muscle relaxers and nerve medicine. But my goal is to take less medicine. So, weigh the options here. And like I said, there's not really too many options. First, I can't take NSAIDs by mouth because I have gastric bypass, so that's one less treatment option. And of course, you can do steroid injections in the arm and wrist. But that's really just putting a band-aid on it, and ultimately not going to be fixed. So you gotta kind of look at it one way. Do you want to have it fixed, or do you just keep wanting to put a band-aid on it? It's like driving with a flat tire. Well, do you just want a patch job and put duct tape or something over the tire, or do you want a new tire and fix it? And you gotta look at it that way. I was going to tell y'all that the outpatient place, he wanted to do it first. Well, I found out the anesthesiologist at the outpatient facility was out of network. Well, Blue Cross won't pay for nothing out of network on the HMO plan. Now, if you have it done at a hospital setting, they will, because it falls underneath the RAPS provision: radiology, anesthesiologist, pathologist, and emergency room physicians. If you have HMO, if you have it done at a hospital, it will be paid as in-network, but they can balance bill you. But if you have it done at an outpatient facility, they won't pay nothing out of network. So it's kind of like a Texas law that they have. But luckily, the hospital does have an in-network anesthesiologist. But of course, there's a chance that it could be out of network, but still get paid something. So, and luckily, the doctor actually called me back and said, "Well, yeah, we can switch you to the hospital. No big deal." Just kind of worried about it, obviously. Not looking forward to this. Who does? I mean, it's nothing like, oh yeah, I'm getting gastric bypass. Oh yeah, I'm getting reconstructive surgery and getting excess skin removed. Nothing like that. It's kind of scary. Now, obviously, I still would have to continue taking, because I currently take gabapentin for the nerve pain. Because I still have numbness and tingling and a little bit of pain on the left-hand side, but nothing like on the right side. But I don't know. It's still a go. If I decide to change my mind, obviously I have time to do that. That's all I know right now. It's just kind of a lot of thoughts racing through my mind right now. Do I continue not do nothing and let it hurt and take pills, or do I go ahead and have it fixed now and get on with life? You gotta look at it that way. You know what I'm saying? Delay medical care and drag your feet and kick it down the road, or have it fixed and move on. You know what I'm saying? And luckily, I don't have to pay nothing, so it's already met my out of pocket, so insurance company's paying for it. So financially, that does make sense to have something done now versus down the road, where the out of pocket's going to be more. Financially, that just makes common sense right there. Like I said, at the end of the day, yeah, you can do physical therapy. You can do you can take medication, steroid injections. But at the end of the day, that's not fixing the problem. It's still going to exist. Surgery will fix the problem. Fix the nerve. You know what I'm saying? I think he used the word, or the terminology, pinched nerve and nerve entrapment. Something like that. So, that's all I know right now. So, if you have any questions, comments, please post them below. And I'll give you, and I do another video, obviously, before then. So, I'll talk to y'all later.